just come out with my 11th book called Hidden Epidemic: Silent Dental and Oral Infections Cause Most Heart Attacks and Most Breast Cancers. And it came about because a good friend of mine was going to get her root canals taken out of the dentist, which we have clear evidence the root canals are bad for you. And when they did a special 3D x-ray of her mouth, not the regular x-ray, but a 3D x-ray, I could see across the room a horribly, grossly abscessed, infected tooth. That wasn't one of the root canals. And I said, Cindy, I've got good news and bad news for you, but the bad news is you're going to have to get another tooth taken out today in addition to the root canals. The thing about this tooth, though, was it was completely asymptomatic. A grossly, not subtly, grossly, horribly infected tooth that is actually on the cover of the book, that had eroded away the bone of her sinus, causing her chronic sinusitis, was completely and totally without symptoms. Now think about that. You have something in your mouth that could quickly give you a heart attack, readily give you breast cancer, readily precipitate any disease imaginable because of the chronic increased toxic oxidative stress that it's causing, and it feels fine. That means, and I'm going to repeat this several times today, that means this test has to be part of the routine evaluation of any medical patient for any reason, but especially for a heart patient or a breast cancer patient. Because you can't find it if you don't look for it. Have you ever, as a physician or a healthcare practitioner, have you ever diagnosed a diabetic patient by looking at them? Have you ever guessed what their blood sugar is? One might be 85 and the other might be 450, and they look the same. Obviously, you have to do the blood test. And what I'm going to try to make the case today is, what I'm going to describe is very, very, very common. Most of the dentists I talked to thought that teeth like this would be very symptomatic, but in fact, the vast majority of the time they're not. And we need to revise our thought of good health. A lot of people, when they're adults, they say, well, I'm 50 years old, I'm healthy, I'm sure everything's fine. But what they call health is, I've got 3 medical diseases under control and I'm on medication. If you've got high blood pressure, if you've got diabetes, if you've got chest pain, if you've ever had cancer, if you have arthritis, if you've had lupus or have lupus, all of these things are fed by this. And many times, they're primarily caused by it. The moral of the story here is, everything that happens to us, even if we think it's good luck or bad luck, happens for a reason. You don't suddenly get a heart attack out of the blue without clear-cut reasons why the heart disease developed. And in this case, over 90% of the time, it develops because of the toxins and pathogens that are being continually seeded from these chronic infections in your mouth directly into the lining of your coronary arteries. All of my presentations, they have a number after the references. You could go to PubMed and immediately see the abstract and sometimes the entire article. I like every time I can to document that what I'm saying is coming directly out of the refereed, peer-reviewed medical literature and not just something off the top of my head. The question that you'll ask is, How come nobody else is talking about this? And the answer is, I don't know. It's in the literature. Before I go directly into the dental aspect, it's very important in understanding why dental infections are so bad for you is to understand why you have disease. All disease, 100% of disease, I don't care what the disease is a manifestation of increased oxidative stress in that particular area of the body. Increased oxidative stress meaning oxidized biomolecules that have lost their electrons and become inactive. And that's the pathology. You have a natural molecule that's lost its function. Nothing could be more pathological than that. So, the main sources of these toxins, now understand all toxins are oxidants. All toxins cause oxidation. All toxins are toxic because of their oxidant effects. If they don't cause molecules to oxidize, they have no toxicity. This is the final common denominator that links all toxins regardless of their chemical structure. So the biggies that I'm going to talk about today is infection related. Then you have toxins unrelated to infections. And then remember that an antioxidant or a nutrient is something that contributes electrons. So if you have a depletion of that, then the power of the toxins is not well matched and you have more toxicity. Genetic diseases, these are because you're missing enzymes that are needed to cause metabolism to take place. And bottom line is increased oxidative stress. And hormonal deficiencies. I don't have a lot of time to talk today, but I'll give you a little head start on it and tell you that if the sex hormones and the thyroid hormones are not perfectly balanced, nothing else is going to come close to having the proper positive impact, regardless of how good the intervention is. What do all toxins and infections have in common? All. When I say all, I literally mean all. I mean 100%. All infections and all toxins cause cell tissue damage and produce symptoms by increasing oxidative stress. No exceptions. No exceptions. I've been looking for an exception for over 10 years. I haven't found one. If it does exist, and I don't think it does, it's the rarest of rare birds. Now, how can one thing like increased oxidative stress cause so many different diseases? That different symptoms, different manifestations? Well, it basically has to do with these properties. First of all, where is the oxidative stress? Inside the cell, outside the cell, in the mitochondria, in the nucleus, in the endoplasmic reticulum, in the extracellular space, where is it located? Number two, what are the biochemical properties of the toxins directly causing that? That brings in different things into play. What are the genetic predispositions? How chronic is the oxidative stress? And how severe is it? So, an antioxidant is a nutrient. This is important too. Nutritious food. Food is only nutritious to the degree that you ultimately digest it and break it down into molecules that have antioxidant properties. So if the food that you eat ultimately gives you more molecules at the cellular level that are able to donate electrons, then that food is nutritious. And just the opposite, fried foods, What happens when you fry food? You oxidize it. So you start eating more foods that have a greater percentage of the molecules already having lost their electrons than that.